Okay, so let's finish out the nervous system by talking about the peripheral nervous system. So, when we talk about the peripheral nervous system, you know that anything that has the word nerve in it is the peripheral nervous system. And so, in the peripheral nervous system, we have both cranial nerves and spinal nerves. So, cranial nerves are nerves that are on the undersurface of the brain. So, if we look here on the lower left side, we're going to have nerves here related to the sense of smell and then to the sense of vision because the nerves from your eyeball are there. And then we have a bunch of nerves that do things like move your eyeball, give you sensation to your face, give you motor to the muscles of your face, allow you to open and close your mouth for chewing, and do other things. So all of these activities, like from your neck on up, are going to be related to cranial nerves. And then everything below the level of the neck are going to be related to your spinal nerves, nerves coming out of your spinal cord. So when we look at the peripheral nervous system, we have two divisions where we're looking at these motor nerves. The somatic nervous system is what we have talked about previously. This is what controls the skeletal muscle. And now in this section, we are going to be talking about the autonomic nervous system, which is involuntary and is going to involve those other effectors, the cardiac muscle, the skeletal muscle, and the glands. And we will have two different divisions, the sympathetic division and the parasympathetic division. And when we're done, come back and look at this picture here on the lower left and see what you have learned, because I'm not going to talk about this picture right now, but you'll be able to do a lot of details about this picture. Okay, so to review the somatic nervous system, we talked about one motor neuron whose cell body was in the central nervous system. The axon and the axon terminal were in the peripheral nervous system. At the synapse, acetylcholine was the neurotransmitter that was released and carried the message over to the effector organ that was skeletal muscle, which was under voluntary control. And that axon was myelinated, as illustrated by these things that look like marshmallows on the axon. Okay, so all of that should be reviewed. The autonomic nervous system, the first big difference is that is a two motor neuron chain. Whoa. Okay. And it is an involuntary control, meaning the effector organs are totally different. They're all internal organs, your cardiac muscle, i.e. your heart, your smooth muscle, all your other organs, and your glands. So think, your salivary glands, your lacrimal glands for tears, your gastric glands, all kinds of glands throughout your body. Okay, so here's how we can draw that. Okay, one neuron synapsing with another neuron. Okay, because we're stick figure kind of drawings, we're going to have a ball, a line for our axon, and then fork it for the axon terminal. So here is our two neuron chain. As you know, anytime you have a synapse in the peripheral nervous system, it has to occur in a ganglion. So we're going to have a ganglion here. So we're going to, when we talk about our two neuron chain, we're going to have a preganglionic neuron. In other words, the neuron that is before the ganglion. So the axon terminal of the preganglionic neuron is what goes to the ganglion. So the preganglionic neuron has its cell body in the central nervous system, in the spinal cord. Then it has its axon travels, and then the axon terminal enters the ganglion. It's going to synapse within the ganglion with the cell body of what is called the postganglionic neuron, whose then axon exits the ganglion, and then its axon terminal is going to be at the effector organ. Okay. Of these two axons, only the preganglionic neuron is going to be myelinated, so it will look like this. Okay, So the preganglionic neuron has some myelin on it. The postganglionic neuron is naked. Okay. All right, so this is how it's going to look. All right, so far we have only talked about acetylcholine as a neurotransmitter because that is the neurotransmitter that was involved in the somatic nervous system. So once again, learn how to spell acetylcholine. And we are abbreviating capital A, capital C, lowercase h. But in the autonomic nervous system, we are going to use acetylcholine and we are going to use one other neurotransmitter. And that other neurotransmitter is norepinephrine, which is also noradrenaline. It's kind of like the Greek and Latin name for the same thing. And so if you know the word adrenaline, then go with noradrenaline. If you know the word epinephrine, then go with norepinephrine. So norepinephrine is abbreviated NE, noradrenaline is abbreviated NA. And now you're going, well, Dr. Powell, what the hell is norepinephrine or noradrenaline? So let me show you what these substances are. We can start with proteins. And from these proteins, they make a substance called DOPA, which I know you don't know what this is, but DOPA actually can be used to make melanin in your skin, okay? DOPA is what the hormone that when the sun hits makes the melanin, the melanocytes make the melanin in your skin. But it also is used to make that neurotransmitter dopamine that we talked about previously. And dopamine, with one little change, we can get rid of this COOH thing, will become noradrenaline. And then with from noradrenaline, we can make adrenaline. Okay, so they're all related. They're all kissing cousins to each other. Okay, so acetylcholine is involved in somatic nervous system. It's the only one involved there. But in the autonomic nervous system, acetylcholine is still going to be involved most of the time. Okay, but norepinephrine / noradrenaline is going to be involved a little bit of the time, specifically at one location. Okay, so let me talk about that. Remember I said in the autonomic nervous system, we have a sympathetic division and a parasympathetic division. Well, both of those are going to have a preganglionic neuron and a postganglionic neuron. Okay. In the ganglion, acetylcholine is always the neurotransmitter. So whether you're sympathetic or parasympathetic, that preganglionic neuron is going to be releasing acetylcholine, which is going to bind to the postsynaptic neuron and cause a new nerve impulse. In the parasympathetic nervous system, acetylcholine will still be the neurotransmitter at the effector organ. But in the sympathetic nervous system, the postganglionic neuron is going to be releasing noradrenaline / norepinephrine, whichever word you want to use, to synapse with its effector organ. So this is the only one that is different. And this actually allows us medically to affect this synapse without affecting any of the other synapses that use acetylcholine for their neurotransmitters. So it's kind of a cool thing medically. Okay, so just remember, acetylcholine is used everywhere except the postganglionic sympathetic neurons, axon terminal, at the effector organ. That's the only one you need to remember that is not acetylcholine. Everything else is acetylcholine. All right. So just to make sure you're getting this, just to make sure you understood the somatic nervous system and you're understanding this, we're going to have a little pop quiz today. So when you're done, be looking under assignments and find a pop quiz to make sure you're understanding all of this, because I want to make sure, we have a test every 3 weeks, and I'm finding just a lot of people are just waiting till the end of 3 weeks to try to study, and it's just too much. So let's just try this pop quiz thing. Oh, I'm just kidding. But I want to ask you, how did you feel when I said you were having a pop quiz? Did your heart start pounding faster? Feel like your blood pressure went up? Did you feel like you wanted to run away? Well, you know what happened? Your sympathetic nervous system started working. Your sympathetic nervous system comes into play in a scenario that we call fight or flight. So here's the classic scenario. You're at school, it's the end of the day, you're tired. You're walking into parking structure 4. All of a sudden, somebody walks up to you with a gun. And you're sitting there for a split second and you have to decide, am I bigger than this little person? Can I sit here and fight? Do I think I'm going to win? Or am I going to turn tail and run away? And you're going to be making those decisions in a split second. Okay. So, most of us with a gun, we're going to look at that gun and we're going to say, I'm dropping everything and I'm running. Right? Because my life is more important. So let's stop and think. If we want to run away, our heart rate and our blood pressure are going to go up, right? Kind of makes sense. All right. Our airways, the tubes that bring air to our lungs, they're going to expand. Their diameter is going to get bigger so that more air gets in. I didn't say your lungs were going to get bigger. I didn't say your respiratory rate was going to get bigger. I didn't say any of those things. Those things are not equal to each other. What I said was your airways were going to dilate so that more air can come in when you take a breath. The blood flow to your skeletal muscle is going to increase. So in other words, your blood vessels to your skeletal muscle, they are going to dilate so that more blood flow goes to your skeletal muscle. Why? More blood flow, more oxygen, so more mitochondria, so more ATP, so more muscle contraction, so you can run away. Okay. Also, sympathetic nervous system causes orgasm. Yeah, without your autonomic nervous system, you could not have a good sex life. Okay. When we look at the sympathetic nervous system, as you know by now, we have to have a 2-neuron chain. When we look at that 2-neuron chain, they are short then long. In other words, the preganglionic neuron is very short. That ganglion is right outside the spine. So that preganglionic cell body is in the spinal cord. The axon comes outside the spinal cord for that spinal nerve, and right there, sitting outside that vertebrae, is where the ganglion is. So that's a very short neuron. Then the postganglionic neuron cell body goes from there all the way to where it needs to go, to the target tissue, all the way to your heart, all the way to, not to the skeletal muscle for you to run away, but all the way to the blood vessel in the skeletal muscle. Okay, this is smooth muscle showing here, not skeletal muscle. All the way to the smooth muscle in your airways, all the way to the smooth muscle for you to have an orgasm. That postganglionic fiber is long, so we say it's short, then long. Okay, and remember, when it comes to neurotransmitters, Between the short and the long in the ganglion, we're going to have acetylcholine, and between the postganglionic long fiber and the target organ, we are going to use norepinephrine. And also don't forget this preganglionic neuron, even though it's not shown in either picture, is going to be myelinated. In contrast to the sympathetic nervous system, the parasympathetic nervous system is what I like to call the rest and digest. So think about Thanksgiving Day. You have finished eating. What are you going to do? Well, maybe you're going to sit on the toilet for a while. Maybe you're going to watch football. Maybe you're going to take a snooze. Okay. So your pupils are going to contract for near vision. Your heart rate's going to slow. Your blood pressure is going to lower. Your digestion, your blood flow to your digestive system is going to increase. Blood flow to your skeletal muscle is going to decrease. We don't need to be running away. We need to increase our digestion. And we're not going to have an orgasm, but gentlemen, your parasympathetic nervous system is what causes the erection. You can't have the erection. You can't have that satisfactory sex life without the parasympathetic nervous system as well. And when we look at the parasympathetic nervous system, we say it is long, then short. The cell body for the preganglionic neuron is in the spinal cord, and then its axon travels all the way to the effector organ, because the ganglion is either just outside the effector organ or is actually in the wall of the effector organ, so that the postganglionic neuron axon is very short. Okay. And remember, both of these neurons are going to be releasing acetylcholine for their neurotransmitter. And also don't forget the preganglionic neuron is going to be myelinated. Okay, so generally, but not always, the sympathetic and parasympathetic are going to have opposite responses. And yes, for the responses I talked about, they were opposite responses, but they are not always opposite. And if you go into nursing, this is going to be an important point when you get into nursing school. And the other thing is homeostasis is a balance between these. Your body is constantly giving either sympathetic or parasympathetic, or blocking sympathetic or blocking parasympathetic. It's constantly doing this. Okay. So here's quick think. I've got 3 different things going on. Name which part of the nervous system. Notice the differences. Talk about the axons. Name the different types of neurons. Talk about where the cell bodies are specifically located, where the axons are specifically located. Talk about what's myelinated, what's not myelinated. Talk about what the effector organs are. Talk about what the specific effects are, if they're voluntary, involuntary, and talk about specific neurotransmitters. And with that, thank you so much for all your hard work, because we are done with the nervous system. And well, technically not done, because we haven't done senses. But before we talk about senses, I am going to diverge and talk about the endocrine system, because it really does relate to the nervous system. And then I'll come back and do senses afterwards. Thank you.